Namaste. My name is Saurabh Nanda and this is my YouTube channel. Thank you so much for visiting and watching this video. As I had said in my introductory video that I would be inviting a lot of my seniors, mentors, people who inspire me on this channel to have meaningful conversations. One such conversation which is very important for me is regarding mental health issues, especially during the lockdown. That is why I have invited my mentor, Dr. Arti Anand, who works as a consultant clinical psychologist at Sir Ganga Ram Hospital, New Delhi. Dr. Arti Anand is one of the preeminent clinical psychologists in India today. She has more than 22 years of experience in this field. So join me in welcoming Dr. Arti Anand on this episode of a weekly segment revolving around mental health issues during the lockdown. Dr. Arti Anand, thank you so much for being here. How are you?
I'm fine, thank you, Saurabh. I'm really glad to be able to come and help people during lockdown in your series.
Thank you so much, ma'am. It's not only my series, I think it's both our series. हम दोनों एक साथ इसको कर रहे हैं एंड आई होप कि लोगों को हेल्प होगा. सो मैम, ये बताइए कि लॉकडाउन में आप क्या क्या कर रहे हैं? हाउ डू यू स्पेंड योर टाइम? आर यू गोइंग टू द हॉस्पिटल?
No, I'm not going to the hospital, but I'm doing most of the time online video counseling. I'm busy with my household work, and also I'm also I do reading and generally watching TV and connecting with my family members. We play board games or tambola in the evening. We have a huge joint family, so we are connecting with one another and bonding.
That's great. So आपके आसपास कॉलोनी में everything is normal, I hope. मतलब nothing special or serious or
in our colony, everyone is like following the rules of the lockdown. Nobody is going out. I'm able to communicate with my friends on FaceTime, video calls, Zoom meetings. Busy with that. So in the house, I think there's no problem because I'm keeping myself busy even with all the work as well as doing some kind of exercise, basically reading a lot these days, and actually I don't get time.
Well,
So
that's
that's
actually good. If you, I mean, if you're keeping yourself busy, I think it also helps in mental health, keeping yourself sane during this extraordinary time.
one more thing I forgot to tell you. I'm not watching the news about coronavirus or all the negative things. So mostly my energies are focused on various other things in the house only.
Oh, that's a great tip, actually. ठीक है मैम, तो let's start the interview, right? I think the first question that I really wanted to ask you are just to help people understand what depression is all about. So why are people depressed during the lockdown? I mean, I understand it's almost been more than 40 days now, I think, when we are under lockdown in India. तो ये 40 दिनों में लोगों को डिप्रेशन क्यों हुआ, अगर हुआ है तो? What are the
Huh,
reasons?
there are many reasons. First, I will like to tell you, सबसे पहला reason जो depression का है, the most basic that comes to my mind is that hearing and seeing all about coronavirus and focusing all your energies in listening and talking about it 24 into 7. Okay, that leads to a lot of negativity in your mind, negative thoughts and worrying and anxiety. And actually, this anxiety will culminate into depression. It can culminate into clinical depression. So this is one very important thing because people are thinking कि अब क्या होगा. They are attaching this negative thoughts or these negative images and communication with their future, which makes them sad, anxious, fearful, and leading them to depression. Now, second most important thing is that most of the people are not able to earn. They are not able to earn their livelihood. Many of them are not able to get their pays. They're struggling with their finances, and they are worried about the future, which is very, very normal. I mean, it's not irrational, it is rational as well as fear is very, very logically founded, that if in 1 or 2 months I don't get money, or if I don't get work, what will I do? So these thoughts are also leading to a lot of negative and uh, emotional lockdown in their own minds.
Mm.
Third is many of them are their everyday routine is being stopped. They are not able to go out. They are not able to do socialization, or small things they were able to do, which they want to do, are not. They are totally restricted in their own homes without any. They were not given. Most of us were not given any warnings. Suddenly a lockdown, and for a long period of time, many of them are thinking that they are in a cage, as if they are in a cage and they cannot go out. So that feeling leads to helplessness, and that helplessness can really lead to worries about the future. Actually, the worries about themselves, their families, and their jobs, and because of that, they can lead to sad mood and negativity, and hopelessness. Feeling of hopelessness also can come in that. Now, there's another very important reason, that many of them who were earlier on psychiatric treatment or on psychiatric medicines, they were having a routine. They were going out. Suddenly they have nothing to do. They have no communication with the outside world. Okay, and their whole routine is gone haywire. Because of that, also many of the old patients who had become all right are coming back to depression or anxiety, and they will be needing counseling and medication. Both will be required for them. Then another thing is, most of us have, we are so busy in our lives, we never spent time with our family members. Now we are forced to spend time with others whom we don't want to. Okay, so there is a lot of conflict between family members. That is also giving them problems, right, and relationship issues, leading to depression and anxiety.
Wow.
And one thing else, I can also give you another example. Which these are all the cases that are coming to me through them. Now, the elderly, basically the elderly, they are also very much affected. Why? Many of the elderly people were not working, but they were socializing. Many of them, right, they were going for parks, clubs, going out for regular walks. All that has been taken away from them. Okay, so they are feeling helpless. What to do at home? They at least were having, their mind was working, their physical activity also, both mind and physically they were active, and it was being used. Now they have nothing to do. They have to be, they feel, many of them, they are at the mercy of their children, or they are feeling helpless because of the whole environment. So elderly people are also facing a lot of anxiety and depression. Many of them never knew what depression is because of this lockdown. They are unable to even do their daily routine at home because of that negative uh, thing in the whole environment they have assumed to be negative, and when that happens you also become lazy, lethargic, and in a state of that you try to give up. So all these things are coming back to the elderly people, which we thought the elderly are, doing so well in their this part of their lives. Uh, Last but not the least, there's one more thing I would like to tell you that many one of my patients, I'll tell you, she felt depressed because because of the guilt she had, that I'm feeling very guilty, that I'm not able to do anything productive. I'm not studying, I'm not going for work, and I'm not able to help others also, like who are having this infection. So unnecessarily guilt is also coming to people in this situation कि मैं तो घर में बैठी हूँ, मैं कुछ नहीं कर पा रही. So this is also very important thing, that sitting at home, all thoughts, illogical thoughts are engulfing many of us because of no activity. And because of this illogical thoughts, which are mostly negative in nature, you lead to depression and or fear, anxiety, helplessness. So these are the major things, major reasons of getting depressed. Why people are so much in trouble these days in lockdown.
Wow, that is a long list of reasons, ma'am. So, मुझे जितना समझ आया है, what I understand is, I mean, there are reasons which are beyond our control, right? Because of uncertainty, the lockdown, there was no warning, we cannot go to work, we cannot go to school or college, and I think they are because of the environment which is outside the home, and then there is environment inside the home, which is, we are forced to live with our relatives, our parents, our siblings, for a longer amount of time, which we are not used to. So it's causing some kind of conflict over there as well. At the same time, for the elderly, it is because their routine has been completely disturbed. Even for normal people, it has been disturbed. And then a lot of people are feeling guilty because they're not being productive, they're not helping out, they're just doing nothing. And they're not used to doing nothing, right?
Right.
And so these are all environmental reasons, right, ma'am? Because I remember from my internship with you at Ganga Ram Hospital Department of Psychiatry that you told me there are environmental reasons for depression and there are psychological reasons. Already patients, now they cannot get their regular therapy or medication, and that is another reason, right, ma'am?
Yes.
That's a long list. How do we cope up with both environmental and psychological factors? Are there any tips that we can follow?
Yes, we can. You should I start with the handling of psychological issues?
Please go ahead.
Emotional problems, which you can, they are very easy tips. You can really help yourself at home. First of all, try to distance yourself from all the negative views about coronavirus. Stop talking about them. Okay, that is going to help you. Less anxious, less negative thoughts. ठीक है? Whenever you think about these corona or virus or number of people dying, just shun those thoughts and try to concentrate on calm things, like something calm like a music or a memory where you really enjoyed in the past, that is going to help you out. So or you know just do a relaxation exercise, or a simple deep breathing will help you out. Just concentrate on your breathing. Close your eyes and just concentrate on your breathing and connect yourself to positivity. That will help you out. Now, whenever you're feeling angry and frustrated, okay, try to, the simplest way is to try to count from 100 to 0, or 100 minus 26. So you will focus not on the negativity, okay, the thoughts that are, but you will focus on some other activity that is neutral thing, which is not going to harm you. It is something that is going to distract you from your immediate thoughts. Now, another thing is you can write down your negative thoughts, whatever they are coming. Okay, sometimes when you are doing nothing, all negative thoughts pop up. Okay, we call them automatic negative thoughts. And realistically think about it, those thoughts, and find out whether these thoughts are logical or are they authentic. Test these thoughts. For example, I'm going to die with coronavirus. So is this thought logical? If you're not going outside, if you're doing all those, taking all the precautions, you may not die. Even if you get infected by virus, there are chances you may not die. You may just have mild symptoms. So these are the few things you can, self-positive talk you can do to yourself. Then you can, when you write down, you will also come to know how unrealistic and unfounded these thoughts were. Okay, and you can also change your thought pattern. When you write down, you do, अरे ये तो मैं बिल्कुल बेकार. And also when you're writing down, you can also think what are the skills or techniques or strategies which you employed when you were having some stressful situation, and were you able to come out of it. And you will realize that most of the time when there is stress, I was able to do this and I got out of it. That will give you a lot of comfort, and you will be able to take more positive steps to calm yourself down or to curb these negative thoughts. Now, coronavirus or this lockdown has given us so much of fear. Okay, fear is a very big component. Okay, so how to deal with it? Whenever you feel afraid or fearful, ask these questions. Am I in control of the situation? How much control I am in this situation? Or am I unnecessarily worrying about my environment? Am I able to do something about it? And given my resources in this particular environment, how I can best utilize these resources? Am I really utilizing them or not? You will feel very light when you realize that I have so many other resources which I can rely on. Secondly, many of us during this time are comparing ourselves with others. Okay.
Comparing how?
How? I'm going to, like, उसके पास तो खाना है, he has money, okay, he has food that will last 2 months. What will happen if I don't get money? The food may not last for 2 months or whatever. So you start many times you start comparing without any reason also. Maybe you don't know the future. Maybe the lockdown will be finished or curbed in just few days or weeks, and maybe you will get the job. So uh, unnecessarily thinking about the future can also lead to present depression, because the future, you and me, nobody knows. In future you may immediately get a job, but in the present you have given yourself so much misery just thinking about the future. uh, then uh, then you can do many things. As I said, maintain a diary, write down your feelings. Very important thing is to do is communicate with your family members and talk to them when you are having uh, negative thoughts or emotional problems. Don't keep it inside yourself. Pent up, when you have pent up feelings, you will obviously have frustration, anger, anxiety, helplessness, hopelessness. That will, they will be roaming around in your head throughout. So if you talk to your family members, you'll feel light and you are going to connect with them in a very, very easy manner and bond with them. I think these are the things majorly how to help emotional problems in lockdown. Meditation will really help. Lastly, meditation, relaxation exercises greatly help during stressful times.
Wow. So basically, we have to remain positive and think about positive things, share with others, and not let illogical or negative thoughts creep into us. Right, ma'am?
Yes.
So, I mean, I always had this question in my mind after studying psychology that so most of us understand these things already, that yes, we have to be positive and no matter what, things will be all right. Is there something like a psychological first aid kit that one day I am feeling very low and I don't know what to do, I don't feel like talking to anybody? So just like a first aid kit, a medical first aid kit, is there a psychological first aid kit of any sort that we can make so that we can go to it and help ourselves when we are feeling really low?
See, what I feel, the best psychological first aid kit is that immediately, if you feel you're not able to handle your stress, is to communicate with either your counselor, your family member, or somebody whom you trust, because that can help you immediately. Because most of our problems start when we are not able to share our problems with somebody. So that is the most important thing in I think the psychological first aid from my side. I feel that is the most immediate. Many people say कि नहीं हमारे पास I have nobody to talk to, but you have to find somebody. These days you have counselors, online counseling चल रही है, online you can find psychologists now. In last 10-15 years, you have so many counselors, so many psychiatrists available, psychologists available. You can go and talk to them. There's no harm in it. Or if you feel you have a friend whom you can trust, or your mother or father, you must talk it out without fear, without thinking that something else will happen. Secondly, second psychological first aid kit is when you have some negative thought, stress, tell yourself what resources you have at hand and what you can do to help yourself. at that moment. Write down the resources. If you feel you still you can't find somebody, then the first psychological first aid kit is communication. That really helps. It has always been. In fact, you must have also felt that whenever you have problem, होता नहीं है, somebody says something and you feel very bad about it, and if you keep it for 2-3 hours, you keep brooding and crying and negativity. But as soon as you talk to somebody, you get a fresh perspective about it, about the whole situation, and you feel lighter, and you can act in a much better way, productive way.
That is actually true. So, thank you so much, Dr. Arti Anand. I think we have had a very nice and very nice conversation, a lot of insights, and I think more such conversations are needed, Dr. Anand, for people to understand this. And I hope कि हम इसको we are able to make it into multiple languages also. Right now it was mostly English, but we'll try कि इसको कुछ हिंदी में भी करें हम, ताकि it reaches more and more people. Are there any resources which are available online which you would like to recommend to people if they really need to focus apart from the counselors that you talked about?
Okay. They can listen to motivational talks also. They online may you can go and do some research work, or you can learn some instruments. You are asking me about the how to be productive during the lockdown?
Yes.
So during the lockdown, you can do productivity by 2-3 things. You can be productive by pursuing your long lost hobbies, like learning an instrument, online learning instrument. You can start painting, okay? And online also, there are a few I saw sites which are teaching you. Then there is a site that is helping youngsters to enhance their personality and communication skills. If some of you don't feel that you are shy or you don't know how to talk in a public, you can go and learn. You can utilize this time by brushing up your skills or learning new skills. So and also you can do very many you can attend webinars which give you a lot of information about various topics. Since the lockdown, or podcasts, you can listen to them. If one very important thing which I missed is that exercise. Keep exercising during lockdown. That is going to help you. Yoga, exercise is going to keep you mentally and physically fit to deal with your problems in the near future also. There's one more thing which I really want to add. Sleep. Now, sleep disturbances are very prominent. Most people are having irregular or erratic sleep patterns in lockdown. So, in fact, they should avoid all this and have a set routine and a pattern for sleep. Because if you have erratic pattern of sleeping, then you cannot, you can't concentrate. You will always be feeling low and lethargic, because your whole sleep cycle is disturbed. So if you maintain a proper sleep cycle, regular exercising, daily exercising, indoor exercising, that is going to give you so much of energy and enthusiasm to deal with the lockdown.
Great, amazing. Thank you so much, Dr. Arti Anand. I'm just going to conclude this episode now. Thank you so much for viewing this video. If you have any questions, you can send me a personal message on the social media, and I will make sure that it reaches Dr. Anand so that she can answer to your queries. And also, I would like to tell you that today we talked about depression and anxiety creeping into our minds during this extraordinary lockdown that we are under right now. Next episode, we would like to discuss about another very important aspect of mental health and our modern day life, which is domestic abuse during lockdown. As I said in my introductory video, also that there have been lots of calls to the authorities regarding domestic abuse, relationship problems from homes. So next episode, Dr. Arti Anand and I will be discussing that. Please subscribe to this channel so that we can make better content for you. And please provide us a lot of feedback. Tell us what you think of this, how we can improve this. And that's it. Thank you so much for viewing. And
Thank
have
you.
a safe lockdown. Ma'am, thank you so much.
Thanks. Thank you. Bye. Take care.